If you've ever had that nagging pelvic pain that just doesn't make sense, the kind that doctors struggle to explain, that seems to move around and just leaves you feeling completely frustrated, well then this explainer is for you. We're about to unpack a condition that affects millions of people but is so misunderstood.
So, let me ask you this. What if that ache deep in your hip, or that constant feeling like you have to pee, or even that sharp tailbone pain, what if it has nothing to do with your hip, or your bladder, or your tailbone at all? What if the real source is hiding in a set of muscles that are just working way too hard? Let's get into it.
For so many people, the answer is a condition called pelvic floor overactivity. And to really understand what that means, we're going to lean on the expertise and clinical work of a real specialist in this area, Dr. Farzana Khan from the Women's Health Clinic.
So yeah, Dr. Farzana Khan is going to be our guide through all this. She's a medical doctor who has dedicated her career to women's health, and it's her deep understanding of this issue that's going to help us connect all the dots.
I mean, just look at this experience. We're talking more than 20 years in the field. She got her medical degree back in 2003, and from there has just built this incredible career in OBGYN and reproductive health. Now she's actually training other doctors. So yeah, I'd say we're in pretty good hands.
All right, let's get right to the main idea here. Because when most of us hear pelvic floor problems, our brains immediately jump to weakness, right? But for chronic pain, the problem is often the total opposite. It's not about weakness, it's about tension. It's about muscles that are too tight and just can't let go.
Think about your pelvic floor like a muscular hammock that holds up all your pelvic organs. Now imagine that hammock being pulled tight all the time. It's in a constant state of spasm, it's shortened, and it literally forgets how to relax. This isn't weakness at all. It's pure exhaustion from being chronically overworked.
So why does this happen? It pretty much boils down to one of three things. First, there's protective guarding. You have an injury, a surgery, or even a bad bladder infection, and your body tenses up to protect itself, but then it never gets the memo to stop. Second, there's repetitive strain. Think sitting at a desk all day. And third, and this is a bit one, stored emotional stress. If your nervous system is always on high alert, your muscles are too.
Okay, now this is where it gets really mind-blowing. This is the reason there's so much confusion around pelvic pain. Here's the big secret. The place where you feel the pain is often not where the actual problem is. It's something we can call ghost pain, or what doctors call referred pain.
So what's driving this ghost pain? It's these things called trigger points. The easiest way to think of them is as tiny, angry knots inside that already tight muscle. And these knots are so wound up that they actually choke off their own blood supply. This creates a low oxygen zone that just screams out pain signals and stops the muscle from ever healing.
And this kicks off a really nasty, vicious cycle. So, step 1, that tight knot starts irritating everything around it. Step 2, your brain gets these alarm signals and, trying to protect you, tells the muscle to tighten up even more. Then, step 3, that little knot starts sending its pain signals somewhere else entirely. And finally, step 4, just the fear of that pain makes you tense up and the whole awful cycle starts all over again.
And this slide, wow, this just lays it all out, doesn't it? That deep buttock pain you were sure was sciatica? Well, it could actually be coming from a muscle deep inside your pelvis called the Obturator Internus. That pain right at the tip of your tailbone could be the Coccydynia muscle. And that bladder urgency that's driving you crazy, it could be the levator ani muscles. It's no wonder that treating the spot that hurts doesn't work, because the source is somewhere else.
And it's not always about that ghost pain. Sometimes a tight muscle can cause a really direct, sharp, and awful pain by basically acting like a vice grip and literally squeezing a nerve.
So let's get into the anatomy for a second. There's a really important nerve for sensation down there called the pudendal nerve. It has to pass through this tiny little tunnel. But get this, that tunnel is formed by the very same muscle we just talked about, the obturator internus. So if that muscle is in a constant state of spasm, it literally crushes that tunnel and the nerve inside it. And that's what can cause those awful burning or electroshock type pains.
So, knowing all of this now, it's probably not a huge surprise that a lot of the standard advice you might have heard about pelvic health is just completely wrong for this condition. Let's bust some of those myths right now.
Okay, this is the big one. The myth that every pelvic floor problem means you need to do more Kegels. But the reality is, a tight muscle is an exhausted muscle. It's already weak because it's so tired. Trying to strengthen it by doing Kegels is like trying to do bicep curls when your arm is already in a painful cramp. It's just going to make things worse. You absolutely have to release that tension before you can even think about strengthening.
And maybe the most important reality check of all. In the powerful words of Dr. Khan's clinic, is this pain all in my head? Absolutely not. For anyone who's ever been dismissed or felt like they were imagining their symptoms, please hear that. It is real.
And you know what? There's physical proof. A specially trained pelvic physio can actually go in and find these trigger points. And when they press on one, it often causes something called a jump sign. You literally flinch involuntarily. It's clear, physical proof that the source of your pain is a real, tangible knot in a muscle.
Okay, so we get the problem now, right? It's all about overtension, those trigger points, and a nervous system that's stuck in overdrive. Just knowing that is a massive first step. So what's the path forward? Where do we go from here? Well, it all starts with calming that system down.
A huge piece of the puzzle is self-care that helps tell your nervous system it's safe to relax. We're talking about things like deep belly breathing, not chest breathing, using a heating pad to soothe the muscles, gentle movement like walking or stretching, paying attention to your posture, and finding ways to manage stress that actually work for you. Now, these self-care strategies are the foundation, and they support the amazing work you can do with specialists. The gold standard treatment is often internal hands-on therapy from a pelvic physio to release those trigger points. There's also biofeedback to help you literally see and learn how to relax those muscles. And in really tough cases, there are options like Botox injections. Plus, it's so important to address the fear-pain cycle, often with a counselor. In the end, getting relief is a partnership between you and your healthcare provider. And I think Dr. Khan's professional philosophy just says it perfectly. Clear explanations, realistic expectations, and shared decision-making. It's about you being empowered with the right information and working as a team with an expert who truly gets it.
So we'll leave you with this question to think about. For so many people, just hearing that their pain is real, that it has a name and a physical cause, that can be a life-changing moment. Could truly understanding why you're hurting be the very first step to finally getting better and taking your life back?